brings us to your weekly capsule of health information. We call it Your Healthy Dose. No stranger to the show is Hannibal Regional Medical Group Director of Outreach Services, Aaron Zook. Aaron, good to see you again.
Good morning. How are you this morning?
We're doing all right.
Good.
Happy Friday, by the way.
Yeah, it is.
Something that is called Tele-Health, and I think this was brought up in one of our other conversations, but it was in the works, but it didn't happen. Now you've made it happen.
Yes, it has happened. We were glad to bring the technology of telehealth to Northeast Missouri about a year ago. We utilized it at first for a way for our physicians to interact with other physicians at the University of Missouri and other teaching hospitals around the United States to participate in grand rounds and things like that. Now we're able to use telehealth to deliver services to patients and have patients access services as well.
So this is really, it's like going to a doctor's appointment, but the doctor's physically not there.
That's right. He's there virtually. There is always a nurse in the room with you. So on the physical side, a nurse is there to assist the doctor, answer any questions that there might be, but the physician is there virtually. So it's through a high-speed connection, high-definition monitors, things like that. 40-inch screen, the doctor's right there looking at you.
Interesting.
It is. It's very interesting.
So you can actually see him and talk to him, or see her and talk to her, but they may be off-site.
That's right. They may be off-site. They could be across the United States. There's been instances where specialists from different countries have even visited with patients here in the States. The physician is able to examine you using high-definition cameras. There's actually applications with stethoscopes where the nurse is able to place that on your heart, and the physician can hear it through the high-speed connection. So he can assess heart sounds, breath sounds, things like that.
What a great use of new technology.
It is. It really is. It's a technology that is being embraced. A lot of institutions on the East Coast are using this to be able to reach out to areas that aren't served with specialists or physicians, and we're working to do the same thing right here at home.
So telehealth really is a new or different kind of healthcare. I mean, it's something that people are going to have to adjust to.
It's something that, yes, we're going to get used to. And, it's not really a new kind of healthcare. It's just a different delivery system. You still have the interaction with the physician. You still have the interaction with the nurse. You're able to ask questions. The physician is just available to you via this telehealth connection.
And are these local physicians, or are you looking for more of a specialty type situation where somebody needs to talk to somebody who specializes in something that may be across the country?
Believe it or not, it's a little bit of both. We're able to offer services to people in our region for specialists that might be based out of the University of Missouri or somewhere else. Dermatology, for instance, we know there's a need for dermatology, so we have an agreement with the university that if we have a patient who needs dermatology services, they're able to come to our Hannibal Regional Medical Group building in Hannibal and able to access services of a dermatologist in Columbia. And on the flip side of that, our mental health professionals provide services in critical access hospitals across the state of Missouri, like Scotland County up in Memphis. We provide mental health services to those folks.
Is this also something, too, that you'll use in an emergency type situation, in an ER environment where you're assessing whether to transport a patient?
There are capabilities to do that. We don't utilize the technology that way at our facility just yet, but there are places where, yes, that's able to be done.
That would be the next step.
Yes,
Interesting.
It would.
So really, telehealth offers pretty much a broad spectrum of services.
It really does. There's a wider range of services that can be accessed. There are some services where initially you need to go see a physician first. So, for instance, we have a relationship with the Thompson Center for Autism in Columbia that helps to evaluate and treat autistic children. So patients from our area go down to Columbia for an initial treatment. And then they're able to do all their follow-up work in Hannibal. So instead of driving 2 hours for a 15-minute appointment, those children are able to come to Hannibal and follow up with their physician in Hannibal.
That's great.
It is
very helpful to the families and to the kids.
Absolutely. It's hard enough to drive 2 hours to get to an appointment, let alone, get there, the kid's worn out, and they got to go through an appointment and come back. So it's great that they can just come to our campus, short drive, see their physician, and go back home.
Yeah, especially if you're dealing with bad weather or something like that, too. That's a good point.
Yep.
How long has Hannibal Regional Medical Group had the technology to use telehealth?
We've had the technology for over a year. And like I said, initially we started out a way for our physicians to access medical education opportunities, a way to converse with other physicians at different sites, things like that. within the last 6 months, we've offered services to patients. So we've had great response from those that have used the service. You know, at first, they might be a little apprehensive because it is different, and we acknowledge that. But, you know, once they get in the room and they're able to interact with the doctor and interact with the nurse, they get done and say, you know, it's just like any other visit, and they're very pleased. Just yesterday, I had a family from Vandalia, Missouri that was able to access a specialist. They're in our office in Hannibal instead of driving 2 hours to a different location, and they were so glad to be able to do that. So it's great to be able to see that happen.
Do you use laptops in the examination rooms, or they're monitors?
They are like 40-inch high-definition monitors. It's not broadcast over the internet. It's over a secure network line. So
that was my next question.
Yes, we are part of a secure network called the Missouri Tele-Health Network. And then that Missouri Tele-Health Network is part of a national group as well. So the Missouri Tele-Health Network maintains all of the secure communication lines. So it's not like it's broadcast over the internet like Skype. It's similar to Skype, but the technology is much different.
Closed line, yeah.
Closed line, yes.
All right.
Absolutely.
All right. I would imagine, too, this kind of technology also kind of reduces anxiety with the patient.
Absolutely, it does. And it's funny you bring that up because a lot of the younger patients, they feel more at home looking at a telemonitor and conversing with the physician back and forth versus, you know, talking face-to-face with the physician. So, yeah, it does reduce a lot of anxiety. And, you know, the travel factor, the fact that, oh, my gosh, I got to drive 2 hours to get to the appointment. I got to be there on time. You still have to be on time. You just don't have to drive 2 hours to get to the appointment.
Sure. Are there satellite campuses participating at, say, for example, like Pittsfield, you said Scotland County?
Yes, yes. So within the Missouri Tele-Health Network and national networks, there are endpoints all over the United States. Within Missouri, there's over 80 other endpoints. So
wow.
Critical access hospitals, those kind of places have this technology, and we're able to link with them and provide that service back and forth. It's something we are looking at expanding within our own organization to be able to offer, you know, Pittsfield to Hannibal or Hannibal to Mexico, those kind of things. So.
Phenomenal.
It is phenomenal.
And it's good to know it's not being shared by those wanting to look out at eBay or something else on the internet. It's
absolutely
a whole different network.
This is dedicated for medical purposes.
Awesome.
Aaron, is this something that the patient is aware of prior to going into the treatment room?
Absolutely, it is. It's something that we talk about up front. You know, we always provide options. So if it's a specialty we don't offer in the area, we say we do have an option that you can access that specialty by coming here and visiting via telehealth. We're always glad to show a patient in the room if they're a little apprehensive and provide them with any way that they can educate themselves about what telehealth is. And a great way to do that is to go to our website, Hannibal Regional Medical Group, all one word, .org. In the search box, just type in telehealth, and it'll bring up about 5 different links for different telehealth articles that you can read. Or they can contact me directly at my office to ask any questions, and my phone number is 573-406-5842.
Oh, great use of technology, and what a good thing for the patients to be able to access physicians all over.
Absolutely.
Right there from Hannibal Regional.
And, you know, our physicians are able to reach out to those places that are underserved as well and help those patients. So it's great to be able to access services on our end and be able to provide services on another location.
That's great. The use of technology moving forward.
It moves us forward.
That is good to know. All right. Aaron Zook, thank you very much for sharing some of this. This is phenomenal.
Thank
Great
you.
information there,
Good to be with you guys.
And good to have you here. And that's Aaron Zook. Again, he's a director of specific, let's get it right here, Director of Outreach Services with Hannibal Regional Medical Group. And again, if you'd like more information, you go to hannibalregionalmedicalgroup.org. Aaron, thank you very much.
Thanks, Aaron.
Thank you, gentlemen.
That's this week's edition of Healthy Dose. It's brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. You can also get more information online at hrhonline.org.